Hello, and welcome to this presentation on physical and electronic veterinary medical records. My name is Maureen Kelly, and I'll be teaching you on this subject today. When regarding the information to include in a veterinary medical record, be sure to include the client's reasoning and details about bringing in the patient's recent behavior at home, any test results, possible diagnoses, or treatment plan options and courses for the patient, and the patient's medical history, anything specifically highlighted that could be related to the patient's present condition. You should be sure to not include personal information, judgments, or biases towards the client, such as regarding their appearance or attitude towards you during the visit. Any advice or theoretical diagnoses from anyone other than the veterinarian. What a tech or receptionist believes is wrong with the patient is not a legal medical diagnosis, or any irrelevant details to the case, such as commenting on a puppy's cute appearance or anything not medically or legally necessary to include. Signalment is a key part to any veterinary medical record. Signalment is a term regarding the brief description at the beginning of a medical record given to quickly inform anyone reading the record of the patient's name, age, sex, species and breed if applicable, reproductive status, and may also include the patient's weight, the client's name, and the chief complaint for the day's visit. For example, this patient's name is Charlie. He's 4 years old. He's male, he's a canine, mixed breed, terrier and hound. He's neutered, weighs 52 pounds, and his chief complaint is a laceration on the dorsal aspect of the left front paw. The signalment for this medical record would be as follows. The patient Charlie is a male 4-year-old neutered hound mix presenting with a laceration on the dorsal aspect of the left front paw. Correcting an error on record. Correcting an error in a medical document is crucial, not only to track when the change was made and who made it, but also to make it clear to anyone who reads the record in the future of the exact mistake that happened and where the correction is, in order to ensure the patient's safety and the best environment to heal in. Following a systematic method to correct errors ensures that the mistake is legible and clearly marked as a mistake, and that it will be less likely for the same mistake to happen again in the future. The correct steps include a single line strike through all you'd like to mark as a mistake on the record, the day's date and your initials written above the struck out words, and the correct information should be written after or above the struck out mistake. Electronic or online medical records. The pros and cons. The risks to electronic or online medical records include privacy concerns. Physical records being kept in a folder in a locked filing cabinet sounds far more secure than an iPad with a 6-digit passcode sitting out on the counter to many clients, and they worry about where their information could be being sent. Financial issues. A clinic can only have electronic records if they have a budget for all the technology and possible training that comes along with it. Interruption of workflow. The introduction of technology and online records into the workplace could disrupt the normal efficiency and way of maintaining records, possibly leading to more errors, especially with first-time learners and hesitant or confused workers. The benefits include possible improvement with productivity, efficiency, and possibly even creativity in the workplace. Quick and easy access to patient records. The ability to share information and patient records between clients, clinicians, and techs promotes legible legal documentation, which can be harder to come by with physical medical documentation, and reduced paperwork and storage costs.